opioid addiction and overdose fatalities. Mr. County Executive.
Thank you, Commissioner. Thank you, Commissioner. Good morning, everyone, as we are here for this very important ceremony to raise the flag of hope during this Suicide Prevention Month. 5 years ago, I lost a friend to suicide, and it was a shocking, tragic incident that, of course, everybody who knew that individual may move on in their lives, but never forget that tragic day, because suicide is a permanent solution to a temporary problem. Very often individuals are at their darkest days, never seeing the light that actually will occur because better days are ahead. And they take the ultimate solution and the ultimate action, which unfortunately is permanent. And while it may end their pain, it causes pain for so many others. And that's why we join here annually at the Rath Building to raise the flag of hope, to let people know that no matter how much pain you're in, no matter how dark it may seem today, brighter days are ahead. There are people who love you, there are people who care about you, and they want you to see that those better days are coming. You just need to talk to people. If you know someone who seems like they're in a very difficult situation, they're very depressed, you need to talk to them. Do not be afraid to talk to them, because your discussion with them may be the difference between them living or dying. And that's why we are here today. And I want to thank all the advocates from the various organizations that work on this issue every day. While Suicide Prevention Month is September and Suicide Prevention Day is September 10th, every day of the year needs to be suicide prevention. Each and every one of us has a role to play to ensure that individuals don't take that final fatal step. And if you are someone who's in a very, very dark situation, feeling that no future exists, please know that it does. And there are people who care about you and love you. If you're having problems at any time, 24 hours a day, 365 days a year, you can call the Suicide Prevention Hotline at 988. It's an easy number to remember. We all know about 911. Well, 988 is the number to talk to the National Suicide Prevention Hotline, to talk to someone who cares about you, someone who knows that your days will get better. It may seem dark today, but brighter days are ahead. Do not be afraid to talk to someone who you think is in a stressful situation. And if you yourself are in crisis in a stressful situation, call 988. You will find out that better days are ahead. And thank you to each and every one of the individuals who stands behind me for the work that they do to save lives in their community. Because trust me, they are saving lives. Each and every one of the advocates here works hard to ensure that everyone realizes that brighter days are ahead. And those statistics that were listed by Commissioner O'Brien, at least as they apply to Erie County, would be much worse if it wasn't for the tremendous work of the people behind us. So to all, thank you for your good work. And once again, if you are in a crisis situation, do not be afraid to call the hotline at 988. Do not be afraid to talk to someone else, because better and brighter days are ahead. Thank you.
Thank you, Mr. County Executive. And now I'd like to bring forth our Erie County Commissioner of Health, Dr. Gail Burstein.
Thank you, Mark. So I'm Gail Burstein. I'm the Erie County Commissioner of Health. And so I want to thank the guests who've joined us here today. And I see familiar faces in the audience, and that is a testament to the commitment we have locally from advocates, survivors, and family members in our community. Already this year, our medical examiner's office has confirmed 50 deaths by suicide in Erie County already. Some of us here have an intense and personal understanding of those losses and what they mean to family members. And the rest of us at least can understand in some small way the waves of grief and pain those deaths have caused for families and loved ones that are left behind. So deaths by suicides are tragic, completely preventable, and represent a complex public health issue. And I think we're all here to stand behind a goal of 0 deaths by suicide in our community. And we also want to stand with individuals who've survived suicide and the loved ones who carry that pain and grief with them. The collective efforts of our county government, local mental health agency, advocates, family members, and survivors have strengthened local resources and treatment options. Just as importantly, We've worked to raise awareness about mental health conditions and address the stigma around seeking care or counseling. So last week, we had an event just across the street to acknowledge the toll of overdose deaths in our community. And our health department is involved in the collaborative efforts of the Erie County Gun Violence Prevention Task Force, because unfortunately, guns are a very effective and efficient way to complete a suicide. We're also offering mental health first aid training in our community to help people understand, how to recognize somebody who's struggling with mental health issues and how to talk to them and be supportive and suggest that they seek treatment or counseling. But this short list describes just some of the moving pieces behind solving this puzzle. So, to our county executives, our other speakers and guests and friends today, I want to say thank you for being here this morning and moving the momentum forward on this very crucial work. Thank you.
Thank you, Dr. Burstein. Next, I'd like to introduce Katie Couric, who is Secretary of the Suicide Prevention Coalition of Erie County, to provide an overview and highlights of the coalition's work. Katie?
Hello and good morning. My name's Katie Couric, and I'm the Secretary of our Suicide Prevention Coalition in Erie County and also the Suicide Prevention Coordinator at the VA Western New York Healthcare System. So it's been another busy and productive year for our Suicide Prevention Coalition. We continue to grow, and now we're up to 54 member organizations. And it's really so nice to see so many of those members here today. We believe that suicide prevention efforts lead to hope, and that hope dispels suicide. That's why we focused on best practices and evidence-based interventions to help make Erie County suicide safer. These are just some of the things that we've done this year. We've trained over 6,000 school staff in suicide risk factors, warning signs, and how to help youth in distress. This past year, we've trained over 1,000 professional staff in the most current suicide prevention tools and approaches. We reached out to a variety of community members with what we call gatekeeper training, so that all individuals can be aware and ready to help someone in need. This outreach has happened in various workplaces, churches, and community organizations. This past year, we emphasized also the need to reach our communities of color and hosted special programs for Black churches. We also know the importance of what we call means reduction, which means that we try to help people have suicide-safer homes. In a moment of crisis, it's unwise to have easy access to highly lethal suicide methods. To that end, we educate on the importance of not stockpiling medications and the really critical need to have all firearms locked and maybe even stored outside the home in times of stress and crisis. On our website, we have a map of locations in Erie and Niagara counties that range from police entities, gun shops, and firing ranges where someone can temporarily and voluntarily store their firearms during moments of crisis or family stress. We've also distributed over 1,000 gun locks to local gun shows and at other outreach events. Right now, we're in the midst of a lawn sign campaign. You can see some of them around here today so that every resident of Erie County can see our important message of how to get help. Where there is help, there is hope. Our coalition remains available for consultation, training, to do interviews, and to talk to individuals at events, and we will continue to do what it takes to make suicide a never event in Erie County. Thank you.
Next, I'd like to introduce our keynote speaker, Sarah Kleiber, who will be talking to us about her. Sarah's here. Sarah, thank you.
Thank you. Standing here today, surrounded by such beautiful people, and next to this beautiful flag, it makes it harder to remember the days when my depression was called loneliness, when my anxiety was called fear, and when my suicidal ideation was called crazy. Labels are born when education is absent. I lived for a very long time with labels. Labels I gave myself because nobody told me that my thoughts were an illness. And those who had similar thoughts, they didn't share them. Therefore, we lived in silence and in embarrassment and in stigma. Fighting myself on the inside while pretending to be okay on the outside, that's just what I did. I called it the soldier's masquerade, until this soldier almost let her enemy win. Today, thanks to many, my darkest hour is somewhere I vow to never be again. And that's because today I'm the face of someone who needs help, but I am the face of somebody who gets help. And that's because I no longer have to wonder where to find it. Labels are born when education is absent. Praise to those who realize this and were brave to do something about it. Please put your hands together for New York State for being the first in our nation to mandate the teaching of mental health in schools. New York, the past is proud of you. The present is inspired, and the future is very excited. Put your hands together for everyone who is not ashamed to admit they need therapy, meds, or both when it comes to improving or maintaining their mental health. You are not alone. I repeat, you are not alone. Can I please get one more round of applause for how far we have come and for the concept of choosing understanding over judgment? Take it from me, those in crisis are not in search of the perfect words. What we want is to be welcomed into your open mind and ears and heart. While there is still work to be done, today is an enormous sign of hope. It is a sign that with every new day, more and more people like myself will feel safe instead of sad. If time stood still, we'd never heal. That's why every day keeps hope real. Thank you.
Thank you, Sarah, for those very moving words. Now I'd like to introduce Jessica Pirro, the CEO of Crisis Services and the chair of the Suicide Prevention Coalition. Jessica?
Hi, everyone. I am very honored to serve as the president and CEO of Crisis Services and the chair of our Suicide Prevention Coalition. I first just want to recognize all our amazing member agencies who are here today. Without all of them, our success wouldn't be shown by our rates here in our community. And I also just want to give a little shout out to Dr. Celia Spacone, our coordinator of our coalition, who due to a family commitment was unable to be with us today, so we send her our love. Today I'm going to talk to you briefly about Crisis Services and also our role with the 988 hotline that our county executive mentioned earlier. Crisis Services provides immediate access to trained crisis first responders ready to answer your call 24 hours a day. This year is our 55th year of service to our community. Our mission began in 1968 with a group of concerned community members coming together to make sure that anyone in crisis having thoughts of suicide, faced with other struggles, would have somebody ready to listen to them, support them, guide, and connect to safety, help, and hope. Our mission has grown over our 55 years of service to include being the network center for the National Suicide Prevention Lifeline, now known as 988. Last July, the launch of the 988 number occurred, replacing the previous 10-digit number. With this number change also came a rebranded name, the 988 Suicide and Crisis Lifeline. In addition to improving access with an easy-to-remember number, the expanded name helps to encourage those in mental health or substance use crisis, in addition to those with suicidal thoughts, to also reach out to this easy to remember number. Not everyone is in suicidal crisis that calls, but the risk, the burden, or struggle they're facing could move them into a stage of being at risk for suicide. We know if we can intervene when thoughts or stressors begin, we can help reduce that escalation to crisis, help prevent entering into the space of crisis that can cripple one's thoughts. They are busy this morning down here. So we can help prevent entering into the space of crisis that can cripple one's thoughts, leading to seeking suicide as a method to stop their pain. With one call, we can help implement coping skills, develop a safety plan, get connected to resources, including reducing access to lethal means, and help build a sense of hope. For the 988 line, Crisis Services covers 5 of our Western New York counties, Erie County being our highest call volume. Prior to the launch of the 988 number, our average annual call to the national line for Western New York area was around 6,544 calls annually. In 22 to 23, so from July of 22 to July of 23, the year that the launch of the new number and the new name, the call volume for Western New York nearly doubled to over 12,803 calls. Our team saw the need for more supportive types of calls this past year, showing people were calling sooner for guidance, help, and getting connected to services with the goal of finding hope. Our main local 24-hour hotline, 834-3131, continues to service our community, and we receive thousands of calls a month to that line for those in crisis as well. We believe access to Crisis Services' various hotline services, along with our mobile outreach response services, are helping to contribute to our suicide rate continuing to reduce. As your crisis first responders, Crisis Services can't do it alone. We look for our community members to become gatekeepers to safety for anyone in suicidal crisis. So how can you help? Talk to your friends, talk to your colleagues, talk to your loved ones and your family. Be willing to push through your uncomfortable feelings or a view that it's not your role, and become the lifeline someone may need. If you witness someone with feelings of burdensomeness, social isolation, or alienation, starting to develop a sense of hopelessness, step in and ask if you can help. Remember, Crisis Services is one call away. We answer the call 24 hours a day. You can call 834-3131 or call 988. Suicide prevention is made up of many steps, as you've heard today, between education, awareness, but the most critical step is connection. Reach out, reach in, and help expand our community's commitment to connection in order to prevent suicide. Thank you. So I'd like to now introduce Robert Canada, who is the Senior Vice President of Business Development and Community Crisis Services at Spectrum Health and Human Services, and is also the Vice Chair of our Suicide Prevention Coalition.
Hello, everybody. Raising the flag of hope is to promote mental health and suicide awareness. It also reminds us that there's always hope and people in this community that work together as a community to work towards, or that truly care, and that will also work towards zero suicides. I'd like to introduce our musical accompaniment, Pastor Ashlyn Marchese from the St. Paul's Lutheran Church. And I'd also like to invite our county executive, our Commissioner of Mental Health, and our Commissioner of Health with the flag raising.
so weary. When troubles come and my heart burdened be, then I am still and wait here in the silence until you come and sit a while with me. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. There is no life without its hunger. Each restless heart beats so imperfectly. But when you come and I am filled with wonder, sometimes I think I've glimpsed eternity. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up to more than I can be.
On behalf of the Suicide Prevention Coalition of Erie County and Spectrum Health and Human Services, I'd like to thank all of you for coming out today and joining us, especially the comments by our County Executive, Mark Poloncarz, Dr. Gail Burstein, our Erie County Health Commissioner, Mark O'Brien, our Commissioner of Mental Health, Jessica Pirro, Chair of the Suicide Prevention Coalition, Katie Couric, our Suicide Prevention Coordinator and also Secretary of the Coalition, Sarah Kleiber for your wonderful keynote address, and Pastor Ashlyn Marchese from St. Paul's Lutheran Church for your wonderful singing as we raise the flag. We can't say enough to thank all of you for coming out tonight, today, and all of your tonight. I'm already ahead. And all of the entities that are represented here today to help end suicide. There's truly help, and there's hope in our community, and help is available to everyone. Like our county executive said earlier, we can't make it any simpler. 988, 24 hours a day. So I want to thank you again, and I want to turn things back to Mark O'Brien to close out.
Thank you, Bob, and thank you everybody for coming. And as he did a wonderful job, we'll get a nice round of applause for everybody here. Thank you so much for helping lead people out of darkness. A couple quick things just to close. Just remember one thing, things that you do not see when you see suicide is purpose, hope, and connection. And if we have those three things, we are leading people out of the darkness. And I would encourage everybody, if you know somebody who's even thinking about suicide, go ahead and ask them, because nobody ever gave anybody the idea of suicide who wasn't thinking about it. A load shared is a load lightened. So again, thank you all, and have a good day. Thank you again.
For the media, just so you know, we've been joined by our County Clerk Michael Kearns, and if there are any on-topic questions, we'll take them at the podium. Any off-topics will be taken to the side. Are there any on-topic questions?
These were, yes, that was a great question. That was from the National Suicide Prevention Foundation. So those were national numbers.
Yeah, hi. Yeah, thank you for that question. So far this year, the medical examiner's office has confirmed 50 suicide deaths among Erie County residents, and we're only just a little bit halfway over the year, so it's it's a struggle. Last year we saw an increase from the year before, where in previous years we've been seeing, for the past 3 years before that, we saw consecutive decreases, but fortunately we may be on a trend to see an increase. That's why it's very important that everybody remain aware, thinking about yourself, thinking about the people around you, and reach out and touch somebody, talk to them if you think that there could be any possibility. And again, we offer free mental health first aid training in the county to any individual, any group that's interested, and I think that's really a great way that people can feel empowered, that they can feel comfortable talking to somebody who they believe is struggling with mental health issues. Sure. Do you want to talk about our Mark? Do you want to talk about our county resources? Yeah, we want to talk about. Again, in Erie County Health Department, we offer mental health first aid training. That information is up on our website, and I'll turn it over to Jessica Perot to talk about the other amazing resources that are available in Erie County.
Yeah, so just as a reminder, Crisis Services 24-hour hotline. We have trained counselors available to anyone in the community 24 hours a day. That number is 716-834-3131. We also encourage utilization of the 988 line. Again, that's a national number, so for any of the other counties besides Erie that are watching today, please know that number is readily available to you as well. There's many partner agencies here today. In addition to obviously our team at Crisis Services, we have our team from Spectrum Health here. You can see all the signs here. We got Prevention Focus is another amazing organization. Our other behavioral health providers, Best Self, Horizons, Endeavor, for example, are organizations that people can call for treatment. There's a lot of amazing resources in a collaborative group that works together. So a call to Crisis Services will immediately connect you to our partner agencies. We also provide mobile outreach services. So if somebody is in a heightened crisis, Crisis Services for adults 18 and over, we have teams that go out in the community to provide immediate intervention and support to try to keep that person safely in their community with additional help, safety planning, and resources. For children, Spectrum Health CARES program provides that same level of care and support for children and families. So there are readily available resources to be able to respond at any time, 24 hours a day here in our community. I'll just highlight for the Suicide Prevention Coalition, which is all of these folks behind us here, they have been partnering up this past several years to really look at access to lethal means, which is really a critical piece when you're talking about suicide prevention, is the thoughts and intent, but then the access, right? So one of the major strategies this past several years has been firearm safety and suicide prevention. So several of our partner agencies here, actually this upcoming weekend, will be at the Hamburg Gun Show, tabling, handing out gun locks to individuals. We raffle off gun safes as well and do a lot of education around safety when it comes to lethal means, because guns are obviously the highest lethal means access for suicide. So the Lethal Means Committee of our Suicide Prevention Coalition has done amazing work over the last last few years, in addition to handing out a lot of gun locks too, with our partners at the Department of Health. They have been a huge resource and champion of getting gun locks out in their own various activities. But we also have the Google map that Katie mentioned on the Suicide Prevention Coalition website that allows people information on where to safely store a gun in a moment of crisis, for family members to get help and resources, because those are one of the big areas is reducing that access to lethal means, and the gun safety component has been a big focus for us, and we have definitely seen some reduction in that mode when it comes to our suicide deaths. I don't know if any of the other partner agencies, Bob, I don't know if there's anything you wanted to highlight from Spectrum.
I just want to add, you hear the theme that it's 24/7. There's phone support available, and there's mobile crisis teams that can come out pretty much anywhere in Erie County. So for kids, for adults, there's plenty of services available. Within Spectrum Health, I'll highlight our Buffalo Hope team. This was a team that came out of New York, Project Hope, to deal with COVID. And Buffalo Hope was funded for the past year by New York State and the Erie County Department of Mental Health to be able to provide free, anonymous, confidential counseling. So, sometimes people say, I don't want to give insurance. I don't want to even give my name. The Buffalo Hope program at Spectrum is one that you can call 9 to 5 pretty much, Monday through Friday, some Saturdays, some Sundays with activities. Not even have to give your name. So again, there's all kinds of resources in our community. You can reach out to any one of us. Anybody here that's ever on the phone, or if anybody pulls anybody aside and says, hey, I know somebody, where should I go? There's plenty of resources, and people here will give you leads. They'll connect you with people by first name so that people don't always feel like they have to call and out of the blue and have nowhere to call. Thank you.
Thank you everyone for being here. This is once again a ceremony for today, but September is Suicide Prevention Month, but as we need to think about it, every day needs to be Suicide Prevention Month in Erie County. Thank you all for being here, and to the people behind me, I just appreciate all the good work that you've done, because you have saved lives. Thank you, and if there are any off-topic questions with media, we'll take them to the side. Thanks, everyone.